Hi, good afternoon. I'm Dwight De Leon, and welcome to another edition of Rappler Talk. Today, we are joined by Quezon City Mayor Joy Belmonte to discuss the COVID-19 situation in Quezon City. Good afternoon, Mayor Joy.
Good afternoon, Dwight, and good afternoon to everyone who is tuned in to today's show.
And yes, before we start, we'd just like to remind our audiences that we are live on Facebook, on Twitter, and on YouTube. So if you have comments, please comment them down below, and we might read them later on in this interview. So, Mayor Joy, let's get right into it. This is the fourth day of the new lockdown scheme in Metro Manila, and Quezon City being the most populous city, not just here in the capital region, but also in the Philippines, is really at the forefront of this pilot run. So please tell us, what are the initial reports on the ground 4 days since the implementation of this new lockdown scheme?
Well, as you know, this lockdown scheme has two components. No, the first is, of course, the implementation of granular lockdowns, as the national government would like to call them. No, that is not new to us here in Quezon City, because actually Quezon City has already been implementing the equivalent of the granular lockdowns, which we call special concern lockdown, since May of 2020. So we only tweaked our guidelines a little bit, no, to conform to the national government guidelines. But in essence, it's exactly the same as how we've been doing it in the past, and we've in fact added more benefits to the people under lockdown, no, given the situation that we're currently in. The second component is, of course, the alert level system, no, and I personally believe that it is better to have this alert level system because this is actually the system that is being used by other countries like Singapore, like the United Kingdom, I think like Australia, etc., where it is akin or similar to what the Disaster Risk Reduction Council in our city, in our country, is using, wherein there are alert levels, let's say yellow, orange, or red, and in this case, it's 1, 2, 3, and 4, and there is a different meaning with regards to each alert level that pertains to transmissibility of the virus, the capabilities of our cities or our LGUs in looking after our cases, and in terms of average daily attack rates. So I think these are the criteria. Doon naman sa DRRM, it is of course yung millimeters of rain expected and gustiness of the wind, etc. And there is an equivalent behavior that is anticipated of every individual for every alert level. And for me, that is actually the feedback I have been getting is that is actually more comprehensible, more understandable to the people as compared to what we used to use. No? Dati, nung ECQ, GCQ, MECQ at MGCQ lang, okay naman yon. Kaya lang nung nadagdagan na yung heightened restrictions with more restrictions, heightened restrictions, parang nagkagulo na. Medyo nalito yung mga tao, no? So, hopefully, with this alert level system 1 to 4, kung hindi ulit magkaroon ng half, alert level 1 and a half, halimbawa, or alert level 1 and 3/4, kung sundan lang talaga natin yung alert levels, people tell me it's more comprehensible, it's easier, simpler to understand.
Uh-huh. Mayor, we'll dig deeper in dito sa two components nitong new lockdown scheme. But first, a number of mayors have expressed then their reservations about the new lockdown scheme. Not necessarily opposition, pero parang may mga ilang factors lang doon sa new lockdown scheme na parang medyo hindi sila komportable. For example, San Juan Mayor Francis Zamora said na parang there's a better way of classifying alert levels for the Department of Health. Then we have Navotas Mayor Toby Tiangco saying that he finds the new lockdown scheme a bit confusing. Kayo, Mayor, when the new guidelines were released, are you completely satisfied with it, or are there parts of it that you think could still be tweaked?
Well, to put it this way, Dwight, no, alam mo naman na nag-backtrack ang national government. At the onset, they wanted to implement this pilot a few weeks ago. And at that time, I do believe they were ill-prepared, no, with regards to what exactly they wanted done, the outcome they wanted to see and how they wanted things implemented. Kaya nagkaroon ng confusion kaming mga mayor. For example, sinabi nila na dapat magkaroon ng granular lockdowns, no, as a way to open up the economy, no. So the granular lockdowns are actually equivalent already to what we know as ECQ. Pero ang dahilan para dito ay para hindi na kailangan ng blanket quarantine category sa buong lungsod or NCR para maka-recover din ang ekonomiya, no? So that's one component. Pero they did not do away with the old ECQ, MECQ, GCQ. They still called it GCQ. Pero may alert levels 1, 2, 3, 4. As you know, what happened then was when people saw the word GCQ, automatically in their mind, ang nakita nila ay pagbubukas, openness, no? Kaya naghanda ang mga restaurants, naghanda ang mga negosyo, bumili ng inventory, pinatawag nila ang kanilang mga empleyado para magtrabaho na. Yung pala, alert level 4 ang gusto ng pamahalaan, which is actually pinagbabawal ang dine-in, pinagbabawal ang personal care services. So lahat ng mga inakalang ng mga negosyanteng papayagan na, hindi naman din papayagan dahil sa alert level. So there was a miscommunication, there was I would say a contradiction there was some inconsistency there, and that is why even if it was a last-minute decision on the part of the national government to go back to MECQ, at kaming mga mayor, I myself only heard about that on the radio. Nagulat din ako doon. Still, I think that was the prudent decision to have made, considering that itong bago nilang sistema with lockdowns, tapos GCQ, tapos alert level, medyo hindi maayos pa ang kanilang pagko-communicate sa taong bayan. Now, having said that, no, they were given a week to tweak, to fine-tune. And in that 1 week naman, I must admit naman din na maaga nilang binaba yung guidelines. No? I think it was 3 days before implementation, binaba na nila sa mga local governments ang mga guidelines. No? In fact, yung guidelines nila sa alert levels nagbago. Kung yung unang guidelines nila, which was broad strokes lang at verbally communicated to us, wala nga dokumento, was alert level 4, 0 dine-in, 0 personnel care services. Alert level 3, I think, is 30%. Alert level 2 is 50%. And then alert level 1 is 100%. Ngayon, dun sa tweaked version ay pinayagan na nila yung 10% dine-in with fully vaccinated individuals, 30% kapag nasa labas, etc. No? So you can see na meron pa rin pagbabago doon sa alert level system nila. And given that there was an initial confusion and they fine-tuned it, when we mayors received these new guidelines, we studied them. I can say for myself, in Quezon City, pinag-aralan talaga namin yung mga guidelines na bagong ito. We had the time. We had 2 days or 3 days prior to implementation. If I had questions, I was able to ask the national government officials. They were able to think about these questions of mine. They gave me answers. So kami sa local government, we were able to craft our localized version. No? Kasi lagi po kami may localized version of all of these guidelines. In the localized versions, we try to fill in the gaps. We try to anticipate what our stakeholders would want to know na wala doon sa guidelines ng national government, at doon pinupunaan namin yan. And we were able to post our localized guidelines on time prior to implementation, and we were able pa to have meetings with the various stakeholders, the business sector, the tourism sector, the private sector, the barangays, and our CSOs. No? So we were able to communicate properly. And given that I think that the rollout for us here in Quezon City, it was smooth, no? Because I believe that every system first must be simple, and they simplified it by not stressing GCQ, alert level. Wala na yung GCQ doon sa bagong guidelines nila. Basta alert level na lang, no? So mas madaling maintindihan yon. Tapos they crafted the messaging based on the 3 C's, no? Crowded, confined, and close contact. So nung pinahiwatig nila sa aming mga mayor na ito yung philosophy behind the alert system, that alert systems are based on a certain criteria that I already mentioned, yung hospital bed utilization, yung ADAR, or average daily attack rate, at saka yung kind of variant that is present. Still, to simplify further, in terms of what kinds of businesses can operate, they stress the 3 C's. At doon maliwanag naman, no, sa mga negosyante na kapag closed, and confined spaces, close contact is unavoidable, at saka crowded spaces cannot be mitigated, sarado siya. No? So medyo naging mas maliwanag naman siya. And tingin ko, I think for me personally, I find it better because it is very similar to the Singapore alert system. It is very similar to the British system. It is very similar to the systems that are now being implemented in other parts of the globe. And even the criteria being used now by the national government is also very similar. So kung nalilito yung iba, they can refer probably to how it's done in Singapore, our closest neighbor, no, in terms of that same system, and they can see that it's quite similar. And in fact, ours is even stricter kasi yung alert level sa Singapore tells you halimbawa transmissibility of the virus, tapos yung mga pwedeng maging bukas na mga negosyo dahil sa transmissibility. Tapos yung kaakibat na galaw o behavior na ini-expect sa mga taong bayan. In Singapore nga, there are times when actually pinapayagan pa nga hindi mag-mask yung mga tao kasi kung mababa ang transmission rate, pwede nang hindi mag-mask o kaya pwedeng hindi mag-social distancing. Dito nga sa atin, kahit under any alert level, kailangan pa rin yung minimum health standards ay observe natin. So I find ours in fact a little bit stricter pa nga than what I've seen in other countries. No?
Mayor, let's go to the specifics. For example, para sa mga viewers natin at taga Quezon City, how is an area in Quezon City placed under granular lockdown? For example, I live in a condominium. When would I know that my area is going to be placed under granular lockdown? Meron bang dapat number of cases na ma-meet? Or parang clustered cases ba ito sa isang floor, sa buong condominium ba? How is Quezon City doing it?
In Quezon City, we passed an ordinance in May of 2020, no? And that ordinance has, of course, evolved already as we began implementing this particular measure. So at the start, kailangan talagang may one or two cases, actually two cases from different households, no, which is indicative of clustering or community transmission, no. Tapos later on, nagbago ito, no? So, ngayon kahit isa na lang ang case, pero nakita natin na densely populated yung lugar. Halimbawa, isang depressed community, isang blighted area. Tapos nakikita natin na ang daming tao, na yung mga tao hindi talaga sila capable of observing minimum health standards in terms of social distancing lalo na, no? O kaya naman nakita natin na wala pang ang positive case pero nagkaroon ng super spreader event katulad ng inuman, ng swimming party at ng kung ano-ano pang mga mass gatherings, ay pwede na namin yan ilagay under a special concern lockdown as we call it, no? So, and yung nagde-determine yan ay yung City Epidemiology and Surveillance Unit. Hindi po mga politiko, hindi po mga non-doctors. Yung CESU talaga ang nagde-decide. Tapos, we are just informed. I am just informed about this. And then I am just told we are recommending this for the following reasons. At if for me as a politician and a leader, the reason seems sound, which is almost all the time because the medical community naman are apolitical, no? Then of course we write the necessary documentation that we have to submit to the national government. But now we have done away with these very stringent criteria, which I think the national government guidelines still have, no? Ngayon, basta based on the instinctive knowledge of our doctors, based on their scientific experience, based on their expertise, and they believe that a place, a purok, a sitio, a street, a house, a compound rather, or a building, or a condominium needs to be placed under lockdown, then they will make that recommendation based on their own various criteria. But hindi na yung 1 or 2 or 3 or 4. Kasi I would like to give an example. Doon sa national government guidelines, halimbawa sinabi nila, pag may 1 positive case sa isang floor, ila-lockdown yung buong floor. Okay, that seems sound to me, ha. I think our CESU also probably uses the same criteria. Pero sabi rin ng national government, if there are 2 cases na magkaiba yung floor, ila-lockdown na yung building. Dito sa aming lungsod, we have buildings that are residential that are 40 stories high. Now, do we lock down a 40-story building for 2 cases? Paano na yung ayuda para sa mga pamilyang nakatira dyan? Hundreds of units ang pinag-uusapan natin dyan, hundreds of individuals, no? So, if we stick to very stringent criteria, baka it's defeating the purpose. Kailangan the outcome that we want to see takes precedence over being strict about criteria as they are written in guidelines. If you understand what I mean, no? So kaya may level of instinct dyan na only a medical practitioner can apply, no, based on his experience and scientific know-how.
And that it might also be difficult for the LGU to fund the ayuda for if ever kapag may mga malalockdown na buong building.
Kaya we really kailangan pinag-iisipan natin yung buong picture, no? Kasi kung magiging strict tayo about criteria as they are written down, not really looking at the outcomes you want to see, not being practical about certain things that I believe need further thinking, pero you're blindly lang tayong sumusunod sa mga criteria, baka hindi rin tayo magiging effective. Kaya actually ang bawat lockdown talagang pinag-uusapan ng mabuti ng CESU in cooperation with the barangay, because the barangay is still the one that's going to take the lead with regards to implementing that lockdown, no? Together with the police and augmented by forces from the local government, no? So ang bawat lockdown hindi batay lang sa guidelines ng national government, susunod tayo. Kasi alam naman natin ang bawat LGU, iba-iba ang konteksto, iba-iba ang demographic profile, iba-iba ang resources, iba-iba ang kakayanan, iba-iba ang level of capability o skills, no? Kaya we take all of that into consideration. At may masusing pakikipag-ugnayan, meeting, bago tayo makapag-decide. Pero ultimately, it is the CESU that decides it. And then the barangay gives the input with regards to halimbawa yung size, yung implementation, methodologies, etc. Kaya it is very possible also that hindi masyadong standardized sa buong lungsod ang methodologies because iba-iba rin talaga yung mga inputs ng mga barangays. No? But overall, for me, the general idea must be present, which is you lock down an area that is under threat of spread, no? And then you automatically test right away kasi ang important dyan, hindi lang yung lockdown, right ha? Pero yung instantly nagko-contact tracing ka at nagte-test. At sa loob ng 14 days, we hope that whatever infection might have taken place there ay mawawala na. And based on 2 years of experience or 1.5 years of experience with these lockdowns, we can really see na nagkaroon ng malaking impact itong strategy na ito sa pag-curtail ng spread ng virus, no? Kasi we are able to identify I think 5% ng lahat ng mga tinetest namin sa lahat ng mga lockdown areas natin positive. But I foresee na kung hindi mabilis ang pag-lockdown, which is equivalent nga to the ECQ na hard lockdown, walang pwedeng lumabas ng bahay, walang pwedeng tindahan na mag-operate, baka mas lalo pang naging malawakan ang spread, no? So tingin ko the fact na mababa yung nakikita nating positive cases every time we lock down based on our testing is a testament na effective siya na a COVID response.
And Mayor Joy, just for the clarity of our viewers, kapag ba sila ay nakatira sa isang lugar na may under granular lockdown, is it automatic that they will be subjected to COVID-19 testing or parang randomized ba ito sa isang area na under granular lockdown?
They are all the adults are subject to testing. Of course, children are not yet allowed to be are not tested, no. Because of the lack of test kits, we decide to focus on the vulnerable sectors, which is mostly the adult population. So let's say we've already undertaken about, I would say about 500 lockdowns na ata since May, or even more, no, affecting about, I would say, 70,000 individuals. We have tested about 40 to 50,000 of these individuals, no.
Mayor, how many areas are currently under granular lockdown? And ngayon po ba natanggap na nila yung food assistance perhaps from the national government? Because I think that's mentioned in the national government guidelines.
Yeah, Dwight, to be honest, so I already mentioned that we've locked down maybe more than 550 areas since we started this scheme. And we've always been self-sufficient. Ang ginawa namin, nag-budget talaga kami ng sapat na pondo para magbigay ng food packs good for 2 weeks sa bawat pamilyang maapektuhan. And I would like to stress na kapag nasa depressed area ka, ang isang tahanan, maaaring may 3 pamilya, no? So, it's really family-based, no, ang ating ayuda. We tailor-fit the assistance based on the profile of the family. Kung may mga bata, may gatas yan. Kung baby, may diapers yan. Kung may elderly, may mga vitamins o gamot yan. So we tailor fit the assistance. No? And the city has always been self-reliant in this regard. Ngayon, dito sa bagong scheme ng national government, they have promised to subsidize the ayuda of the local government. And of course, that is warmly welcome. No? Doon sa initial na guidelines na binigay sa amin, medyo nagkaroon ng pagtutol ang mga, or hindi man pagtutol, pero medyo nagkaroon ng mga tanong ang mga mayors. No? Kasi ang dami nilang hinihingi na kailangan namin isumite bago sila makapagbigay sa amin ng ayuda. And while I know that a recent meeting held with the DSWD and our own SSDD, they work towards simplifying these guidelines. Still, one of the things that we brought up is kung napakarami ninyong hinihingi, baka naman tapos na yung lockdown, hindi pa nabigay yung ayuda. No? So, para sa amin dito sa Quezon City, the way we want to think about it is we would like to be self-reliant still. And kung merong bonus na ayudang magmumula sa national government, bonus lang talaga yon. Pero kahit hindi na yan dumating dahil sa dami ng hinihinging requirements at maaring sa dami din ng trabaho na ginagawa ng ating mga barangay, hindi agad-agad mabigay yung requirements. And some of these requirements, for example, include a detailed profile of the members of the families that are going to be under lockdown. Medyo mas mabusising trabaho. And I'm hoping na nawala na yung pagkabusisi niya na, because I know there was a recent meeting held with the DSWD. I hope na-address yan. But in the initial stages of discussion, talagang mabusisi ang hinihingi nilang requirements. And when I heard that, sinabi ko nga sa team ko, let's just continue with what we have been doing. Being self-reliant, budgeting for ayuda on our own, because kung aasa tayo dito, baka magutom pa yung mga taong bayan, hindi pa dumadating yung mga ayuda. No? So kung merong dumating, bonus na lang yan at ibigay natin pa rin sa mga tao. Pero karagdagang tulong na rin yan. No? And then of course, we appreciate all kinds of help. But now, ang pagkarinig ko, although not in detail, is parang may initial 1,000 food packs ata na ibibigay ang DSWD sa bawat LGU in the onset of this particular scheme. That's what I heard. That has to be validated pa, Dwight.
Mayor, you mentioned that when you impose granular lockdowns, it's really the time for the LGUs to take advantage of it and focus on other things to really beef up our COVID-19 fight. So I would like to ask about these aspects. For example, what's the update on the contact tracing efforts in Quezon City? Nag-improve po ba ito since a few months ago? Because back in March, we had our contact tracing source saying that this is the weakest link in the Philippines pandemic response. So in Quezon City, what's the situation like?
Well, here in Quezon City, I'm quite proud because actually we are very good in contact tracing in relation to the situation that we're currently at. No, meaning that we have the most number of cases all the time, being the biggest city. No, but as of this week, ating contact tracing efforts are about 1:11. So 11 close contacts per one positive case, and I think that's quite good given the situation that we're in at present. No, because when you compare it to how we have been or we had been in I think it was April-May or March-April when we had the last surge, yung contact tracing efforts namin doon talaga medyo maraming room for improvement. I think it was only 1:2 or 1:4. Now 1:11, given the same case, the same situation, I think that's very good, no? At yung sinasabi ni Mayor Magalong na 1:37, it actually is quite impossible to do that, because if people do follow the protocols of minimum health standards, social distancing, going only out when you have to purchase essential goods, or going to work, but doing remote Zoom meetings when you can, you will really not have 37 close contacts, I believe, no? Kaya actually hindi naman rin yan, kung less than 37, in other words, Dwight, it doesn't mean that we fail in contact tracing. It just means that we're actually probably doing well in enforcing our minimum health standards. But 1:11 is our current rate at the moment, no? Given our number of cases, which is about 1,100 a day.
And Mayor, how about the number of tests daily conducted in Quezon City? Has it improved?
Yeah, this is medyo my frustration. I would love to test more because I really believe that testing is key, especially now when, with the vaccinations having it helped us in terms of infection. No, many people are now getting the virus but are asymptomatic. No, and in one way that's good, of course, kasi wala silang symptoms. But in another sense, we have to improve on testing because it's very possible na maraming asymptomatic dyan na carriers na kung lumapit sila sa isang tao na unvaccinated or vulnerable, ay maaaring mahawa. No? Kaya ako, I'm a firm believer in testing. Pero ang daming limitations that are beyond the control of the city. The city now tests about 4,000 a day. No? And our molecular laboratory is at full capacity already sa testing niya. Pero even if we want to test more, hindi pwede kasi may limitations doon sa laboratory capacities. And I heard, based on my discussions with our CESU and other health officials, may limitations talaga sa dami ng tests na pwedeng i-process sa ating iba't ibang mga laboratories, no po? Lalo na yung mga para sa gobyerno, yung tumutulong sa gobyerno. Not the private ones kasi you have to pay a lot of money for that. No? So, sana this is an area of improvement. And kami dito sa Quezon City, we are trying to see how we can further improve laboratory capacity so that we can improve on our testing, because for me the key really is active proactive testing, not just kapag symptomatic pero in all cases, no? At ngayon pa nga lang, Dwight, we have a program like that, no? Now we do very active testing sa ating mga frontliners, health workers, traffic enforcers, policemen, at maging sa essential workers. Kahit na walang symptoms, we go out of our way really to test them on a regular basis, no? But we test about 4,000 a day, and for me this can be improved, and one of the goals of our city government is to improve dramatically our testing capacity. If as the national government's direction shows, wala nang talagang massive lockdowns, puro granular na, kailangan talaga i-complement yung granular lockdowns with testing and tracing.
And one of the things din po that complement this is vaccination. And I heard that Quezon City is preparing for the vaccination of minors in the event na magkaroon na po ito ng green light from the national government. So please tell us about your efforts, and ano na rin po ba yung status ng vaccination sa Quezon City, given that it is the biggest, the most populous city here in the Philippines.
Sige. So Dwight, bear with me. I'm going to make some kind of explanations also here for the benefit of the Quezon City residents that are listening. So in the beginning of the vaccination program, wala pa si Delta. No? So I think and of course we knew that the vaccine supply would be quite limited. And so ang instruction sa amin is make your targets based on the eligible population, which is the adult population. No? So the target of Quezon City was 1.7 million people. That is equivalent to 80% of our adult population. No, but only equivalent to about 55% of total population if you include children. So at the moment, we have already reached yung 1.7. In fact, we're nearing 1.8 or 90% of our adult population. So in that regard, we are successful because we've met our targets. But with regards to now meeting the new national target, kasi recently, si Secretary Galvez said with the onset of Delta, kailangan talaga total population ang bigyan ng konsiderasyon, 80% of total population, hindi na eligible population. And of course, if it's total population, yung 1.9 na yan is only 60% of our total population. No? Dun sa fully vaccinated, we have vaccinated about 75 or so, or 79, sorry, about 79% of our eligible population. But if you translate that to total population, that is less than 50% of the total population. And hence, that is the reason why I am and I'm strictly pushing for the inoculation of minors. Number one, because we have seen that minors are very vulnerable to the Delta variant. No? This can be most seen in the situation of our orphanage recently, kung saan halos lahat ng mga bata doon, more than 100 children tested positive for the Delta variant. And we also know, no, based on the records of our CESU, that about 12 to 13,000 children have already tested positive, no, for the Delta variant in our isolation. Well, not just the Delta variant, but I'm assuming it is the Delta variant because dati hindi naman ganyan ang dami ng mga batang nahahawa, no? And ngayon, yung mga isolation facilities namin, we have had to convert them into family rooms kasi ngayon pamilya na ang nahahawa. Dati kasi yung bata hindi talaga nahahawa. If for some reason yung immune system ng bata medyo malakas in relation to the other variants, pero dito very vulnerable ang mga bata, pati baby. May mga babies po tayo na pinapanganak positive na po sila, no? And that's why we have cribs, we have playrooms, etc. in our isolation facilities to take care of families. Now going back to your question, I'm really pushing for the inoculation of minors so that we can meet the new target that the national government would like us to meet, which is 80% of total population. In Quezon City, 30% po ng population po namin, mga bata, minors po, below 18 years old. Kung hindi po payagan mabakunahan ang mga bata, hindi po namin maaabot yung sinasabing na 80% of total population ng national government, no? Hindi talaga. Kaya pero now that I've done the math, no, kasi we are also preparing, sinasabi ng national government, maaring by the fourth quarter, papayagan na nilang mabakunahan ang mga bata. Doon pa lang sa age 12 to 17, we already have about close to 300,000 children, no, of that age range. So kung yung age range lang na yan ay payagan babakunahan, maaabot natin yung 80% total population na magiging vaccinated. And that would mean herd immunity already here in Quezon City. And that is why I'm one of the staunchest advocates for vaccinating minors. No?
Many of these strategies that we've talked about are strategies that also came from the national government. But I would just like to ask Mayor Joy, are there strategies by other cities, not just here in the Philippines, but also abroad that you have adopted or tweaked? May mga ganun po ka ba kayong strategies na parang nakita, ay maganda pala tong strategy na to, i-adapt natin?
Well, alam mo, dito sa Quezon City, yung special concern lockdown nga, tingin ko nanggaling pa sa Quezon City yan eh. Kasi we pioneered that actually even before this was offered as a possible COVID response mechanism of the national government. Even before they released any kind of guidelines pertaining to granular lockdowns last year, the Quezon City government already developed this system. No? And that's why I'm very attached to it. And that's why even while it has become the main policy of the national government, I still choose to follow the system that we developed and that has evolved organically here in Quezon City because I've seen it work, no, in our local context. So that for me, that's one. The second is itong pagiging proactive ng city sa pagtetest. Sabi nga sa akin ng CESU, yung pagtetest namin proactively, kahit walang symptoms, medyo nagkaroon yata ng medyo nag-frown yung DOH doon kasi parang sabi nila yung mga test kits sana should be reserved to test only symptomatic, no? This is of course anecdotal, ha, I'm telling you, just to put this in context, no? Pero kausap ko yung CESU, sabi nila na the DOH mentioned na sana you save the test kits for the symptomatic, no? Pero dito we wanted to do active case finding, no? We recognize that many are asymptomatic, especially after vaccination, and so itong aming bagong program na lahat ng mga frontliners, lahat ng nakikita namin high-risk individuals at vulnerable na individuals, tinetest namin kahit wala pang symptoms, is something also that I believe is something that developed here in Quezon City, and may not be something that is popular with the national government, no? But we are doing it here, and we have found so many. And if you recall, there was a report once that 80 police officers were found to be positive in one police station. That was because of our active case finding program. Not because they had symptoms, but because of our regular testing that we do amongst the vulnerable. And we would never have found out that 80 of our police officers were positive in this particular station if we had not been doing this program that we are now doing or undertaking. We also have a lot of community-based testing sites, I think more than 20 already, wherein people can just go and have themselves tested if they feel like they were close contacts, etc. they are welcome to be tested in our community-based testing sites. We also have partnered with many medical practitioners, one of which is Bantay COVID, wherein people are enrolled, and then there are volunteer doctors that call and text various individuals that are enrolled. They may be suspects, they may be close contacts, they may not even be positive, but just to allay or alleviate their fears, there's a medical practitioner that they can text or call. Now, that is also something that we started here in Quezon City, and this is in partnership with Bantay COVID, which and most of their members are members of the Philippine Medical Association. No? So those are just some of the things that we have, I think, done here in Quezon City. No? And now I'm reading a little bit about what's being done in other countries, and I think that we probably are on the right track with this granular lockdown system, no? Because I know for a fact that Singapore, Thailand, I think Denmark and other countries have adopted also a system wherein people have to learn to dance with the virus already, no, to adjust to the fact that the virus will be with us for many more months to come. That there is actually no end in the visible future, and so people just have to adopt. And I think this is something that Singapore is doing, Thailand is doing, and Denmark is doing. But of course, ang importante dyan, this dancing with the virus and no more massive lockdowns, ang importante dyan, in place talaga yung mga major protocols natin na kailangan talaga in place yung testing, in place yung healthcare system mo, maayos talaga, yung contact tracing, priority pa rin, at yung isolation facilities ay kailangan sapat ang mga bed spaces. No? And otherwise, hindi rin mag-work itong dancing with the virus scheme or strategy. No? So here in Quezon City, yan yung mga areas na sinistrengthen namin. Tingin ko, we have strengthened our isolation facilities already. Madami kaming bed spaces at marami pang pwedeng i-expand doon sa facilities na pinagawa namin. Sa testing, I think na ma-maximize na namin yung paggamit ng aming testing facilities, no? At yung at pwede pang i-improve, like I mentioned earlier, sana ma-improve, and I hope that is with the help of the national government kasi so much lang ang pwedeng gawin ng local government. And of course, yung tracing, dito naman I would like to thank the DILG at yung DOLE because yung contact tracers namin nanggagaling po sa tupad na maayos na ginagamit, hindi pinagsasamantalahan, at sa DILG nagpapasweldo sa mga contact tracers namin.
Mm-hmm. Mayor, you've mentioned about adjusting and dancing with the virus. So liliko lang ako ng kaunti because yung isa sa pinaka nahihirapang mag-adjust dito sa virus or many of their businesses here in Quezon City, especially yung mga hanggang ngayon sarado pa rin. For example, you have the gyms, the spas, because hindi sila kasama sa kasamang nagbukas sa alert level 4. And I think, or I would just assume na these businesses have knocked on your doors again, siguro asking for help or whatever. Do you have stories? What do you tell them? And what have we done to help?
Well, in terms of for me, itong concept of the new normal, wag natin sanang isipin na ang ibig sabihin ng new normal ay wala ng virus at balik sa dati. Para sa akin kasi ang new normal is ito na nga yung new normal na may virus tayong kasama. Minsan mababa ang bilang, minsan tataas. Minsan we can control it. Sometimes it will be a little bit harder to control, but we have to adjust. No? So I always tell, number one, businesses, and I hope that the national government will support also the local government in this area, no, na kailangan nilang i-retrofit yung kanilang mga establishments. And there are actually guidelines already in place by various private architectural firms, no? How to retrofit your business such that ventilation is improved, such that there is less congestion, that you can maximize outdoor spaces, no, etc. So businesses also have to not just be waiting for the eradication of the virus, which might not happen in the very near future, but they should start adjusting also to the fact that this virus is here to stay. But also, kaakibat din yan, marami din kasi akong alam na negosyo na nag-adjust, no? They're using now their outdoor spaces, no? Kumukonti na rin yung mga dine-in spaces nila, no? Dapat rin yung national government mag-adjust din sila na tingin ko na hindi lang basta alert level 4, sarado na itong lahat ng mga establishments na ito. Siguro at some point we also have to evolve yung ating alert level such that it's not just sarado lahat ng gyms, sarado lahat ng salon, sarado lahat ng ganitong klaseng mga negosyo kasi automatic pag sinabi mong gym ay sarado, contained space yan or confined space yan. O kaya pag sinabi mong restaurant ay automatic yan. Ano na yan, crowds. Kasi hindi nag-a-adjust yung business environment, nag-a-adjust din naman sila. So sana yung alert levels natin mag-adjust din in the future para slowly, ang goal natin, ang new normal is really dancing with the virus, but not just a few establishments dancing with the virus, but all businesses should be able to dance with the virus. And the government must be proactive in helping these businesses be able to adjust to a new normal wherein a virus does exist and we have to coexist with it. So here in Quezon City, yung ating QC Pass, contact tracing app, we have an ordinance mandating all businesses to have it, because ang dali ng contact tracing kapag meron tayong digital app na ginagamit. And now, I think almost 40,000 businesses here in Quezon City are using it already. So that's one. We also have guidelines now that we're trying to put in place, and we are currently in talks with various businesses that have been closed for a long time, how these guidelines can be slowly integrated into their plans for the future. And these guidelines include improving ventilation, improving the use of outdoor spaces, probably vaccinating all of your work staff, probably using more natural air, installing more windows. If your establishment is puro for cemented walls, baka you can have windows built in. May mga ganyan na tayong steps na ginagawa dito, together with our city architect and our building official. Dwight, I know that you recently heard that there are a lot of closed setting environments here in Quezon City na nagkaroon ng mga outbreaks. Now,
orphanage, convent.
Now an orphanage and 4 convents. Yes, last week 2 lang, ngayon 4 na convent na, And now we are focusing on these areas kasi now sabi ko sa SES, so hanapin natin lahat itong mga closed setting environments na ito, itong mga long-term shelters na ito, katulad ng mga hospices, mga home for the aged, mga orphanages, mga rehab facilities, mga temporary shelters for victims of violence and abuse or for street children. Hanapin natin lahat yan. Mga correctionals, even our jails. Let's study them and let's work with their management to try to, number one, check their protocols to make sure that they're following the proper protocols given the environments that they're operating in. Number two, check whether their residents are vaccinated, kasi kailangan sana vaccinated ang kanilang at least adult population. Number 3, kailangan dun natin gawin yung active testing program natin sa mga ganitong klaseng settings. At number 4, we are currently having our city architects and Department of Building official go around and look at these closed setting environments to check how they can adapt or retrofit their buildings. So ito yung mga ginagawa namin proactively to help all sectors go back to normal and businesses open safely.
Mayor, let's just take a step back and look at the bigger picture. Because LGUs can only do so much and sometimes you're dependent on the resources from the national government. Mayor, personally, are you worried that the things that you can't have full control over be used against you, especially because it's election season, the elections are approaching? Are you worried that some of the things na hindi niyo naman pala kontrolado o hindi naman fully you don't have full control over will be used against you?
Hindi naman, Dwight, I'm sorry, kaming mga mayors, I don't know if I can speak for the other mayors, but definitely for myself, we have been so engrossed with trying to address the COVID situation that we're not really thinking much about politics. I know I have opponents out there waiting for me to make mistakes, but this is not the time for me to think about them, and this is not the time to think about politicking. This is just the time for me to address this issue and bring down the number of our cases. So I'm not even worried, to be honest, about what they might say or do, because I feel that Quezon City has been coping well given the size of our city, given the population of our city, given the demographic profile of our city, given the way that our people live, that 30% or 25% of our city live in blighted, depressed, and highly dense communities. No, I feel that. We have coped well, because when I look at the statistics of all the cities in the NCR region, minsan nasa pinakamababa pa nga yung Quezon City, nasa 16, nasa 15, mataas na nga yung 13, no? Pag pinag-usapan yung ADAR or average daily attack rate, no? So meron naman akong datos. I'm a data-driven mayor. I only look at data when I make decisions. I look at evidence. And the evidence also from the Department of Health shows that Quezon City is performing well in relation to other local government units, maybe in NCR or maybe other parts of the Philippines when it comes to COVID response. And I think data, hindi mo pwedeng, hindi nagsisinungaling ang datos. And as long as you look at things from that perspective, data, and evidence, wag na muna sa politika. At the end of the day, the data will work in your favor. Tingin ko, Dwight.
And Mayor, before we go, inevitably, all re-electionists, politicians will be measured by how they address this unprecedented pandemic. Bilang final words, what can you confidently tell every Quezon City resident about how you have been as a pandemic mayor?
Well, I can tell I think that the residents can see for themselves, number one, in terms of vaccination. The challenge was so great, and yet we were even one of the first cities to reach our target of 1.7 million. No, and we did it. And again, the people themselves will probably tell you that if you interview them, or you can read their Facebook posts, that we were able to inoculate our people with very little the inconvenience on their part, except for in the beginning where everyone was adjusting. Mabilis siya, maayos siya. Ang sistema namin ay maayos din. We worked and capitalized on the private sector, no? Working with the private sector, working with the homeowners associations, working with our barangays. We adopted a whole of city approach in terms of vaccinating our people, and I think we have been quite successful. We're on track to finish even before the target date of completion, which is in October. I think by end of September we would have reached already our initial target of vaccinating 1.7 million people fully by that time. No, and October is the deadline that was given to us. No? So I think we're okay there. In terms of isolations, I think that the fact na ang dami pang bakanteng kama, considering mataas yung active cases natin, is testament also that we have prepared adequately for isolation. No, at lahat ng mga nasa isolation facilities natin, of course, with the exception of yung talagang masyadong mahilig magreklamo, happy sila. Bakit? Yung gamot libre, yung hygiene kits libre, yung linens libre, hospital beds ang gamit nila, may nurses doon, may doctors, lahat ng mga pangangailangan nila nami-meet, no? Wala naman tayong in other words, we did not make tipid sa mga taong bayan, no? Yung triaging system natin ang ayos-ayos na, kasi hindi ako puwapayag na matagal naghihintay yung pasyente. I always look at the data. Again, I look ilang oras naghihintay yung pasyente bago siya ma-admit sa isang facility, whether it's a hospital or whether it's an isolation facility. And every time pag it's beyond a certain number of hours and it's not acceptable for me, I meet with them and I tell them next week, kailangan ganito nakababa yung bilang. Kailangan 1 hour na lang siya naghihintay or 1.5 hours lang. I give them targets and they meet them because I challenge them. No? And so Quezon City has been very, very good at evolving. From maybe a bad situation, we are improving in the way we have responded. No, we never stop evolving our system. Now, yun yung system namin sa isolation dahil sa dami ng beds namin. We have adopted a hotel-like system. Yung pag-book sa hotel na tinitingnan mo saan may baka bakante kasi may 12 isolation facilities kami. Ngayon, computerized lahat ng booking facilities namin dito, ha? Para kang nagbo-book sa hotel ngayon, no? Sa hospitals namin, we have 3 hospitals. Pag tinignan mo yung data, 150%, 160%, sabihin ng mga tao, bakit sobrang punong-puno ang hospital? Pero it's only because we have placed far more beds than what the national government requires of us. Ang requirement sa local government, 50% of our beds should be COVID beds, no? Pero now, kasi may need. At lahat ng tao pupunta sa Quezon City and we don't turn away anyone. Kahit ng mga kapitbahay namin mga lungsod, we always accept them. So, dagdag lang kami ng dagdag, hire lang kami ng hire ng healthcare workers hanggang umabot sa 160%. No? And that is not a bad thing. That just shows that we have gone beyond what is demanded of us by the national government of 50%. We have gone to 100, 160%, and we can accept even more if needed. No? And that is why kahit papano, our hospital system in Quezon City is surviving. Hindi tayo overwhelmed, no? Because we are adapting. No? Pati yung chapel nga ng aming Quezon City General Hospital, ginawa na namin ICU facility. No? Lahat ng pwedeng gawing safe spaces na pwede nating i-convert, kino-convert natin. No? So, ang dami kong masasabi. Dwight, hindi nagbubuhat ako ng bangko. Sinasabi ko lang na leaders cannot sleep, leaders cannot rest, leaders cannot think about politics during crisis periods. Leaders just have to lead and do the right thing and put the welfare of the people above and beyond everybody else's welfare and personal interest, most especially. At ako rin, sabi mo kanina, diba yung mga businesses nag-aaray na. Dito lang tayo sa Quezon City, Dwight, proud ako kasi we have a stimulus package na binibigay po natin sa ating mga negosyante. It's called Kalingang QC Pang Negosyo, wherein we give wage relief subsidies to our micro and small entrepreneurs and their employees. And because of this, we have been able to save thousands of jobs, almost 12,000 jobs already, and people who would have lost their livelihoods, we were able to help them. And now, nagbigay po tayo ng ayuda sa mga manggagawa na no work, no pay, sa ating pong Kalingang Manggagawa, where we're able to give 2,000 pesos aid to all of those that did not receive any kind of assistance during the ECQ that was held last August. No, we were able to help them. Yung mga pamilya na hindi nakatanggap ng SAP mula sa national government dahil kulang ang dinownload sa atin, nabigyan natin ng ayuda. No? So the national government was able to help them. And lahat ng mga nagugutom na pamilya, nung simula, syempre, lahat ng pamilya tinutulungan natin. No? Pero ngayon, dahil medyo kulang yung koleksyon, no? Dahil nga sa pandemya na naka-apekto sa mga negosyo, still, yung mga nagugutom na pamilya, nabigyan pa rin natin ng sapat na sustento at tinuruan pa natin mag-farming. So one of my biggest and most important programs that stemmed from this particular pandemic is my urban farming program, the Joy of Urban Farming, that became Grow QC, because now we have hectares and hectares of land that we have converted into farming land. And the products of these farmlands, the vegetables that have been cultivated and nurtured and harvested, ito ngayon yung pinapakain natin sa mga mahihirap nating mga pamilya. So like I said, our mantra is always self-reliance, and even in food security, a highly urbanized city like Quezon City is able to achieve some level of self-reliance, no? Just because of what I would call political will and the desire to really make sure that your people are well cared for. No? So, tingin ko, Dwight, ayos naman. In one response ng Quezon City. And I feel it can only get better. Ako lang, umaasa ako na yung projections ng mga experts natin na sana by the 3rd week of September ay nag-peak na yung Delta at mag-trend downward na, sana mangyari na. No? And in Quezon City, although it's too early to tell, in this last week, nakita na natin na bumaba na yung daily active cases natin, bumaba na yung average daily attack rate natin, bumaba na rin yung reproduction number natin, at bumaba na rin yung iba pang mga indicators or metrics. No? And while it's too early to tell if this is a fluke or this is really a sign na bumababa na yung trend, we are hopeful that everything that we have been doing doing is finally bearing fruit. No? So let's just keep our fingers crossed and hope that this is the start of the end of the Delta surge in Quezon City. Even the increase the increase of our growth rate has decreased. So there's a decrease in the increase of our numbers. And for me, as a data-driven person, every day I look at the data, and while this is very micro, in the big picture of things, these are the things that make a leader like me get up in the morning and just say, praise God, what we're doing is bearing fruit. No? So, yeah, siguro that's all I can say, Dwight. No? The
And
data
I
is
think
working
it's
in our favor now.
and I think that's a nice way to end our conversation. This has been a very fruitful interview with you, Mayor Joy. Thank you very much for joining us today.
Thank you, Dwight. My pleasure. And thank you to all the televiewers or the viewers of our show today. God bless you, Dwight.
That's all for today. I'm Dwight De Leon, and this has been Rappler Talk.